This morning, Tuesday, July 14th, the State Department of Health reported that the number of COVID-19 cases in Miami-Dade County surpassed 69,000, and over 1,100 people in our county have succumbed to the virus. We are in the midst of a real spike in cases, so there's lots to review. So over the weekend and earlier in the week, we saw a massive increase in positive cases and a commensurate increase among other metrics. Saturday, for instance, was the high with over 3,500 positive cases reported in a single day. On Sunday, the county's single-day total surpassed 3,200. These are enormous increases, and combined with a positive average rate of around 22%, means we just have way too much virus circulating around us. Now, I generally don't use Miami Beach figures because they have seemed less reliable and not as significant as county trends. But the best data has our city increases following the same trends as the county. At the beginning of the virus, in Miami Beach, we were seeing dozens of new cases each day. When we sheltered in place, that number fell to sometimes single digits and once even zero. Now we've seen spikes well past previous highs and even a one-day spike of nearly 200 new infections. We are beginning to see the results in MiamiDade hospitals. Just yesterday, 236 people were admitted as patients, a single-day high. We also have highs in patients in intensive care and those on ventilators. You have probably heard quite a bit about hospital capacity. Now, as of today, our county capacity for intensive care patients was 423 beds, and we currently have 438 COVID patients. That means our COVID is over capacity at this point. But you should know that we have hundreds of beds that can be converted to intensive care if necessary. The problem is, first, that ICU beds require greater staffing, which we don't have and we will need to acquire. And second, the more beds in our hospitals that we dedicate to COVID issues, the less capacity we have to address the care our community typically needs. And right now, the county COVID census is over 2,000. In other words, before this pandemic, our healthcare system addressed a huge number of important medical procedures every day, and hospitals were often full of activity. Those non-COVID needs have not gone away. So even if we are able to convert beds, find staff and ventilators, which at this point we are capable of doing, we cannot find ourselves in a position where we are unable to address everyday medical challenges that are still vital. So let me tell you where we're headed. The county has closed down indoor dining and imposed a 10 p.m. curfew. We've imposed some additional limitations in our city. If these actions can't reverse these upward arcs, then most certainly in a few weeks or less, we're going to have to consider more drastic measures. But our hope is to avoid that by taking the precautions that helped us flatten the curve back in April. Now, I'm sorry if you're weary of me saying it, but please wear a mask. Find one that you like. It's not a political statement. It's a mask. It is a bit of a sacrifice, but you're doing your part to protect others, including people you may care about and those you don't even know. And finally, let's not forget that in the midst of this are people doing really amazing things. Like my colleague, Commissioner David Richardson, and many of the commissioners and staff in our offices who have taken it upon themselves to do food distributions throughout the week, every week. They have fed over 3,600 families per week for 17 weeks running. Also, our local first responders at Mount Sinai have been absolutely heroic. If you would like to support them, please go online to Fuel Our Heroes, where you can get information on how to provide masks, PPE, and even groceries for these local heroes. So, thanks for your patience and calm. Stay healthy and mostly at home.